Ever wondered how a patient's hospital journey concludes? What steps lead to the moment when they step back into the world, recovered and ready? If so, join us on this exploration of the hospital discharge process. The discharge process is a critical component of a patient's healthcare journey, marking the transition from hospital-based care to home or another healthcare facility. This process begins when the treating physician deems the patient has recovered sufficiently and no longer requires hospitalization. The first step in this process is the recovery period. This is when the patient's condition stabilizes after a medical or surgical intervention. Healthcare professionals monitor the patient closely, ensuring they are recovering as expected. The length of this period varies depending on the patient's condition, the nature of the treatment received, and their overall health status. Once the patient has stabilized, the discharge planning can begin. This involves a multidisciplinary team of physicians, nurses, social workers, and sometimes a patient's family members. They work together to develop a comprehensive plan that ensures a smooth transition from hospital to home or another care setting. Legally, it's crucial that the treating physician approves the discharge. The physician must document this in the patient's medical record, providing clear evidence that the patient has met all clinical discharge criteria. The criteria may include stable vital signs, ability to perform basic activities of daily living, and understanding of the post-discharge care plan. Post-anesthesia discharge scoring systems, also known as PADS, play a crucial role for patients who have undergone anesthesia. This scoring system assesses a patient's readiness for discharge, taking into account vital signs, activity level, nausea or vomiting, pain, and surgical bleeding. The discharge process also considers modified criteria such as the patient's ability to drink and void before leaving the hospital. This is particularly important following certain surgeries or procedures. In cases where regional anesthesia was administered, the discharge process may differ. The patient needs to regain full sensory and motor function in the anesthetized region before discharge can occur. A rare but serious consideration is malignant hyperthermia, a potentially fatal reaction to certain anesthetic agents. Patients susceptible to this condition require special attention during the discharge process. Once the decision for discharge is made, the patient receives detailed instructions about managing their health outside the hospital. These instructions cover medication schedules, wound care, diet, physical activity, and follow-up appointments. This ensures the patient is street fit or ready to manage their care independently or with the help of caregivers. Post-operative follow-up is the final step. This involves scheduled check-ins with healthcare professionals to monitor the patient's recovery progress and address any concerns or complications. In summary, the discharge process is a well-coordinated series of steps designed to transition a patient from hospital-based care to self or home care. It involves recovery, discharge planning, meeting legal and clinical criteria, managing post-anesthesia effects, and providing detailed discharge instructions. The ultimate goal is to ensure the patient is well prepared to manage their health post-discharge, with a clear plan for follow-up care. So, the next time you or a loved one are preparing for a hospital stay, remember, discharge planning is an integral part of the journey, ensuring a smooth and safe transition back to everyday life.